Now, at this point, people are really interested in and beginning to appreciate the role that the environment plays in not only infection prevention, but in infection transmission. So we're looking at, from the infection prevention and control perspective, what is it that we need to have in place that enables others to do the right thing and prevents them from doing the wrong thing?
Our enemy is invisible and is in the environment as well as on our skin and that type of thing. And I don't think that environmental services as a profession is honored and recognized to the degree that it plays a component in patient safety. So we've made it a specific effort to try to figure out what can we do to strengthen their practice, how can we connect the dots between what they do to help them see how it directly affects patient outcomes, and what can we really do to make them feel a part of the whole healthcare team, because it's not just the physicians and the respiratory therapists and those that are putting their hands, it's people like me who are behind the scenes, it's people like them who are cleaning the environment that also have a part in that.
The sometimes, most of the time and always concept came to us because we were focused so much on hand hygiene. And there we talked about having a red rule for hand hygiene, that there was never a time when you should forget to do that, that you really had to do it all the time. And so when we talked about how our environmental services cleaning should be, we thought that that same concept applied. That if people needed to have clean hands to touch a patient, that there needed to be a clean environment that they were going to touch a patient. And so we consider our environmental stewardship, our environmental services people, to be our safety stewards. And we say to them, you have a very important role in patient safety. And talk to them about that the clean environment is very much like the concept of having clean hands, and what good are clean hands if the environment is not clean.
And other people have studied. So you, by using checklists, different techniques of ensuring thoroughness, such as fluorescent dots, you can improve the cleaning, that is, more of the surfaces are cleaned. But we have a more complex study where we're specifically a 4-arm study looking at a quaternary ammonium compound versus a hypochlorite like Clorox type, as well as using ultraviolet light in a complex crossover design where the multiple hospitals in the study, each one will be using one of these different methods and will actually measure, most importantly, actual infection outcomes as opposed to just how clean the environment is.